The postmodern approach to family therapy. Postmodernism in psychotherapy dwells on the principle that reality is a result of subjective experiences and perceptions, which means that it accepts the variability of interpretations and definitions. This is quite different from the modernistic approach, which dwells on the notion that the therapist is the objective observer who is considered as the expert, and families are supposed to be adjusted to mimic a functional family. Families' realities are influenced by familial interactions, beliefs, behaviors, and values. However, studies have also demonstrated that despite family influences, people still possess individualized attributes that give them unique characteristics. Individualized characteristics are what contribute to misunderstandings in different families and relationships. This essay analyzes an article on the integration of postmodern thoughts in psychotherapy. The selected article is by Mutter, titled "The Practice of Integration with Postmodern Therapies, Exploring the Use of Ingram's Model with Emotionally Focused Therapy." The article analyses the clinical applicability of the integration of the postmodern approach, emotionally focused couple therapy, with Ingram's model of theological reflection and family psychotherapy. The paper explores postmodern therapy in relation to theological counseling and how clinical practice and religious aspects can both integrate, resulting in positive outcomes. Mutter indicates that emotionally focused couples therapy is well researched and represents the advantages of being able to solve several issues. Example: emotional disruption as a result of primary attachments due to life cycle transitions, emotionally withdrawn couples, emotional instability due to a chronically ill family member, impacts of traumatic experiences and attachment injuries among couples. Applying this postmodern approach tends to have a long-lasting impact on the couple, with cognitive remodification on the affected. When this approach is utilized in marital counseling, couples tend to learn how to trust their partners and develop mutual empathy, all of which allow a supportive culture for the sustenance of the relationship. This therapeutic technique is quite beneficial since it is built on numerous theories like humanistic psychology, general systems theory, structural family therapy, cybernetics, and attachment theory. Mutter also discusses the importance of Ingram's model and states that it is a multidimensional model of complementarity that differs from the other models by avoiding linearity and dependence on hierarchies. Additionally, its multiple lens view when used in counseling helps in preventing the problem of reductionism. The reason why it is highly used in religious counseling is due to the component of theos, spirituality, which is highly regarded in the worldview and gives room for theological integration. Mutter discusses several themes that are used to demonstrate the integrability of the Ingram's model and emotionally focused couple therapy. The author indicates that both display similarities in the conceptualization of the fact that the patients should be guided with consideration of their worth and accorded necessary dignity. This is demonstrated by the spiritual aspects of life and the humanistic approach in the postmodern technique. The other theme is growth and self-realization, which contribute to the acceptance of change and full immersion in the change process while accepting one's mistakes in the relationship. The two techniques also emphasize relationality, whereby both state that humans are relational creatures, and this is the only way that humans can acquire knowledge of how to treat others and self-modify. Both approaches demonstrate the relevance of the application of attachment theory in the process of strengthening relationships and avoiding external impacts that may affect the couples. The last theme is the emotional aspect of the approaches, where both denote that emotions are a key indicator of external stimuli and require self-realization and guidance to manage and act accordingly to the responses. Generally, the author indicates that a theological approach, with emphasis on the Christian worldview, that utilizes the Ingram model can be well integrated with the postmodern approach of emotionally focused couple therapy and promote significant positive outcomes.